Countries across the globe, including Canada, have introduced new travel measures to contain the Omicron variant, as well as NACI's recommendation for booster shots. What needs to be done to contain the Omicron variant, and who should be eligible for booster shots of the COVID-19 vaccine? Joining me today to discuss both of those topics is infectious disease specialist Dr. Isaac Bogoch.
Hello, everyone, and welcome back to another episode of the show with the Omicron variant spreading and also the idea of booster shots. Joining me now to discuss this is infectious disease specialist Dr. Isaac Bogoch. Maybe we'll just start off with just very simply regarding the Omicron variant. There's obviously lots of talk about it. Some people are concerned about it. Speak a little bit about, though, whether or not we've heard some people saying, it's not a reason to panic, it's a reason to be concerned. Speak a little bit about how concerned you are that, this could become kind of the new news story, and that this could just become a very big issue as we move forward.
Right. Well, Wyatt, I agree in that it's never a reason to panic no matter what. We shouldn't be panicked at all. We should be concerned for sure. We should be prepared. I think it's also fair to say that we just don't have all the answers. But, there are a growing number of anecdotes, which again are anecdotes. It's not good data. It's just anecdotes, but you can't ignore them when there's a growing number of them with arrows pointing in the same direction. And that is that this might be something that we're going to have to contend with here soon. You're seeing it explode in South Africa. You're seeing some outbreaks and community transmission in various parts of the world, including in Canada. So it's here. I think the big question here is how well does it transmit? And also how much protection are we actually going to get from our vaccines? Probably some reasonable amount. And how much protection are people going to get if they're not vaccinated, but they've recovered from an infection in the past? It doesn't look like it's as much as we'd like. So we'll be able to have more, I think, meaningful conversations in the week or two ahead when we know more about this. But of course, in the meantime, when you have a potential unknown threat, we should be careful.
And just is there any indication when we look at other variants, let's say, for example, the Delta variant, is there any indication whether or not, this could be worse than the Delta variant, or is it kind of still just all up in the air?
What's interesting is some of the early data from South Africa demonstrates from a clinical standpoint that people aren't getting as sick with this versus the Delta. But it's too early to make a conclusion on that, right? Like, we don't know if that's the way it's going to pan out. Oftentimes it takes a little bit of time for people to start making their way into hospital, and sadly for people to die. Those are what we call lagging indicators. So it might be even too early before we see that. Basically, most questions related to Omicron all circle back to, we don't know yet, but we'll learn more in the weeks ahead. What we do know is the mutations that are associated with this, and some of the mutations are associated with a more transmissible variant or a variant that can chip away at some of the immunity that we have. And we have some anecdotes and some growing but very early evidence demonstrating that it might actually do this.
And I did just want to ask you quickly regarding some of the travel restrictions from, a medical perspective. Obviously, there's been some confusion around the perspective of the government's role in this. Let me start, though, with the United States. So there's been lots of, confusion as to why some of these travel rules didn't extend into the United States, for example. So are you concerned at all that, the travel restrictions not extending as much as it is to other countries having an impact on the way that Omicron can spread in Canada?
Yeah, let's approach this with two things. There's travel measures and there's border measures. And sometimes we lump them in together, but it's not really the right thing to do. Canada currently has travel restrictions to several countries in Africa, some in Southern Africa, then there's Nigeria, which is in West Africa, and then there's Egypt, which is in Northeast Africa, and then Malawi, which, depending on who you talk to, some will say it's in Southern Africa, some people say it's in Eastern Africa. Anyways, a bunch of African countries, right? But we know this variant is long gone, right? It's all over the world. It's in every continent except Antarctica. There's community transmission in every continent except Antarctica. You gotta wonder if those travel measures are actually doing anything, or if it just makes it look like we're doing something. And it's probably the latter. It just makes it look like we're doing something, but it probably doesn't do much. And if anything, it might even cause harm, right? Do you think any country that discovers a variant of concern is going to be transparent and forthright, saying, hey, look what we found, world? Here, this might be a potential problem, if the response by the entire world is, great, thanks for that information. We're going to shut down travel to you and devastate you economically. So, I don't think that those focused travel measures do a lot. And I don't, if anything, they probably do more harm than good. The second part are border measures, not travel measures, but border measures. So all travelers to Canada, with the exception of the United States, giant gaping hole, all travelers to Canada have to have a test on arrival, and you have to quarantine until that test is negative. That'll slow things down a bit. It will. It's not going to be perfect. Even if we included the United States, it wouldn't be perfect, but it might slow things down a bit. It's just not going to stop the freight train. Of course, by leaving the United States open, it's not going to slow things down a ton, but it probably will still slow things down a little bit.
You mentioned travel restrictions, some of the effectiveness of the travel restrictions. So maybe I'll go back to that. What, going forward, do you think, just elaborate on it maybe a bit more, do you think extended travel measures, even if the government were to do what some people are calling for, to extend travel measures into other countries, do you think that would do anything to limit the spread of Omicron? Because as you point out, it's, relatively spread now to everywhere it can go.
Yeah, no, it doesn't. It's basically that game of whack-a-mole where you're just kind of trying to nail the thing on the head, but by the time you make it there, it's already popped up in many other places. And that's what they did, right? Initially, the travel measures were in several countries in Southern Africa, and then they added Malawi, Egypt, and Nigeria, which, if you look at a map, are thousands of kilometers away from each other, still on the same continent, pretty far from each other. If you really want, then what? What are you going to do? Add travel measures now to Scotland or to Norway or to Belgium, where other cases have been found? You could, but just probably not going to be that effective. It's the cat's out of the bag. I mean, it doesn't mean you give up. Of course, you don't give up. It just, you may as well have some meaningful policy that will actually slow the spread. Border measures will slow the spread. Again, I think we just have to look back at what are the actual goals here. If the goal is to slow the spread of the introduction into Canada, maybe buy us a little bit of time, yeah, the border measures can probably do that. Obviously, with the caveat that they're not doing that for the United States, and there's probably a lot more in the United States than they're actually reporting or discovering. And we'll probably be importing a bunch from the United States.
And what about people who are looking to travel over the holidays with obviously a lot of more, there was uncertainty before Omicron was here, but now there's even more uncertainty. So maybe speaking a little bit about if put yourself in someone else's shoes, if they were going to travel over the holidays, do you feel that it would be safe?
You just have to be careful. So for starters, the rules and policies are changing fast, and they're very unpredictable, or maybe predictably unpredictable. Different countries have taken different measures, some more effective than others, but they can be very disruptive to travel. For example, Japan and Israel just said, no one's coming in. That's obviously disruptive. There's more testing and requirements as well. So I think if anyone's thinking about traveling over the holidays, at least internationally, you got to be aware of that. And, it's important to keep up to date on what the current policies are. From a safety standpoint, the same rules apply, right? There's things that you can do to keep yourself safe and keep others safe. Obviously, vaccination is probably the most high yield thing that people can do. Obviously, wearing them, even if you're traveling to an area that's pretty lax on mask wearing, if you still put your mask on when you're in indoor settings, that's something that you can do to help. There's steps people can take to reduce the risk. You're not going to eliminate risk, not in the COVID era, but you can take steps to reduce the risk for sure.
You mentioned vaccines are obviously one of the key measures to fight COVID. Speak a little bit about, we've heard over the last little while, NACI's recommendation to extend booster eligibility to people over the age of 50. Speak a little bit about, though, even just in general, but if you look further on social media or just in general, the idea of vaccine hesitancy. How concerned are you that, this could lead to more vaccine hesitancy when talking about people getting booster shots?
Right. I mean, I think unfortunately vaccine hesitancy was a massive issue before COVID. And if anything, it's been amplified with COVID. It's been very challenging. And it obviously it's a bigger challenge in some parts of the world than others. It's still an issue here in Canada. It's a much bigger issue in the United States. And I think when you talk about vaccine hesitancy, it's obviously a massive topic, but high level things that will help: clear, open, honest communication about what the vaccines do and what they don't do, about the positive benefits, about the potential rare negative impact, like honest, open communication. But again, as you pointed out, there's so much misinformation and disinformation that's amplified online. And, that's not going away anytime soon. We really need a much more global coordinated effort to combat that. Of course, that includes buy-in from social media companies, et cetera, governments, many stakeholders, like broad stakeholders, to really improve that. And that's not something where, like a light switch, it's going to just be fixed overnight. Like, this is going to be an ongoing issue that we're going to be contending with for some time. I don't have a good answer to this, unfortunately. I think for third dose strategy, it would be so much better if we had coordinated public communication that when people are eligible for this, they should really go out and get it. And here's the reasons why. And, again, more transparent communication on that front. We haven't really heard much. And in fact, the third dose uptake has been rather dismal in Canada. It's been really slow, especially for people over the age of 70 who would benefit from a third dose if they're 6 months out from their second dose. So I think we need a greater sense of urgency on this matter, especially as we're entering the winter holiday season, and especially with an Omicron variant of unknown significance, but potentially serious significance that's sitting right on our doorstep.
And I'll ask you one last question. Staying on the topic of booster shots, you mentioned the 6-month period after your second dose is when you received your third dose if you are eligible for it. But do you feel that, like, there's many people who are speculating and just curious, like, do you think that this vaccine will be one that could be like a flu shot, for example, where maybe not every 6 months, but you have to retake it? Like, are we looking at something with the COVID vaccine where, every 6 months you have to get a booster shot?
I don't know. I don't know. I truly don't know the answer to that. I doubt it would be every 6 months. I think it's fair to say that at least for adults, at least for most adults, I don't even know if all adults, but at least for most people and most adults, this is probably a 3-dose vaccine series. I don't know if it will be for kids, or if a third dose would be necessary later on. Like, we just don't know yet. But for most adults, it's probably a 3-dose vaccine series. And then so the third dose is probably best described as a third dose. Do we need a booster after that third dose? I truly don't know. Well, I think this is something that we'll figure out with time. I hope we're very adherent to good data. I really hope we adhere to good medical and scientific practices and adhere to good data on this. You never want to undercall it, but you also don't want to overcall it as well. So we'll see. I mean, I think there'll be a much better answer to that question in about 6-7 months from now.
All right. Well, thank you so much for joining me, and it's been great chatting with you, and thank you again.
Be well. Nice to chat.